So this is our presentation on Apple Health and the implications of using various data sources. This is a presentation by Linda Lee, Jamie Lawrence, Arbor Shaw, Helen Babin, and Maria Wagner.
So Apple Health is an app that is already embedded into iPhones that can be used to integrate electronic medical records such as Epic. It's an application that would provide valuable information to nurses as well as other healthcare professionals. This application can provide valuable information by listing medications, sharing health data with clinicians, and creating emergency contact person. For example, if an unconscious patient was brought into the emergency room, healthcare providers would be able to look up a patient's medication list through Epic if their Apple Watch was integrated into the system. Some pros of having this device is that elderly patients would be able to use the device to keep track of their medication lists, receive notifications of any irregular heartbeats or heart arrhythmias, and also be able to track the number of calories burned throughout the day. And this would also be able to bring more health awareness to people. Another pro would be accurate health data rather than relying on the patient's words. So if they were to keep track of any notifications for irregular heartbeats, it would be able to sync into their EMR already. And then it also provides a better workflow for clinicians and healthcare providers. Some cons would be IT difficulties. So if the Apple Watch was not syncing to the EMR correctly, or if it's harder for elderly patients to operate since the older generation is not very technologically savvy.
So one of the questions we're answering is, what is the relationship do you see between the type of data streams and the ability to inform and shape healthcare policy in your medical center? So positive patient outcomes, well-rounded care, and it promotes progress. The ability to help shape healthcare policy is dependent on the data source used to gather reliable pieces of information. A database is an organized collection of information that can be used as a resource for many members of a healthcare organization. For example, Apple Health can contain information such as heart rate, exercise, oxygen saturation, and vital pieces of information that many healthcare providers assess when treating their patients. For this information to be automatically fed into the patient electronic health record can expedite patient care plans, increase positive patient outcomes due to the functionality. This specific data source is incredibly practical for patients and healthcare providers. The relationship between these types of data streams and the ability to inform healthcare policy is very beneficial. The data gathered can be transcribed to measure themes, changes, and progress as it relates to the patient. Not only can this help patients and their progress, but information gathered can be used to see how certain approaches may affect others. Overall, the patient health tracking system, where information is fed into their electronic health record, can promote positive change in treatment of patients.
Okay, I'm going to help describe the relationship between the policy at my organization and how they include data streams into electronic health records. I am going to get specific because I looked up how my organization does this. So in 2021, my healthcare organization joined a U.S. healthcare collaborative with the goal of understanding shared healthcare problems. All information that is contributed is first de-identified in order to maintain patient privacy, and then also data catalogs within the hospital system all of them have been created and are closely monitored. When analyzed, the organization can distinguish what data is available and what data is lacking to predict and make calculations for the future. A specific example of this is during the COVID-19 pandemic, my organization used artificial intelligence to create a COVID daily dashboard. This tool helped equip providers and clinicians to know how the pandemic would affect our hospitals and our patients. Furthermore, my hospital and formed a cyber threat and incidents response team to address any possible menace or threat to the systems. If a threat is detected, it is addressed and corrected so that it won't occur again. These data systems are so invaluable in storing information and predicting the needs of the future for the system. Okay. Individual hospitals, how do they stream their EHR data into big data sets? They do this by first tracking mortality, diseases, length of stay, and patient outcomes. By collecting into these big data sets, epidemiologists can predict where specific diseases are trending. An example would be by tracking the incidence of COVID-19 cases and its impact on our health globally. Streaming data into the EHR has been able to help create a better workflow for clinicians. This means that clinicians can view the data to implement evidence-based interventions. An example would be using a glucometer that measures, blood sugar. Syncing the glucometer into the EMR can save clinicians time for entering the results manually, thus creating a better workflow. All right, lastly for me, national healthcare policy, how is it supported or not supported? How does it improve data streams into electronic health records or into big data findings? So national healthcare policy does actually support the inclusion of data that streams into the EHR. The national healthcare policy has created legislative frameworks and even incentives to ensure that data is being used appropriately. In addition, national healthcare policy supports streamlining of data by offering financial incentives to providers that participate in Medicare and Medicaid. The Centers for Medicare and Medicaid Services uses these big data findings to help measure the cost and the quality of services provided in healthcare settings.
Discuss how nurse-sensitive data can be used to create health policy at the state or national level. Nurse-sensitive data can create health policy on a state level by predicting the prognosis of diseases, creating social programs, promoting policies that help ensure patient safety and clinical policies. An example would be examining the cost of operating a hospital and the number of staff that hospitals would have or hire. On a national level, nurses can use nurse-sensitive data to promote policies that support and ensure the safety of providers and patients. The role of a nurse with nurse-sensitive data is to ensure that there are accurate data that can help generate further research into health policy. For this case study, nurses can ensure if there's an accurate data in Apple Health that's being uploaded to the patient's portal. Clinicians like nurses can view this data to determine if the patient has a high risk of having cardiovascular diseases. Nurses can implement interventions like having the patient see an adequate nutritionist. On a national level, nurses can use this data to implement policies to lower the cardiovascular rates. One example is ensuring insurance companies to give an incentive to patients that have a gym membership. Obtaining a gym membership and being active can reduce the risk of cardiovascular disease, which then can decrease the mortality of the disease.
Describe ethical and security issues involved in including patients' personal information in EHR. While there are several benefits to EHR systems, there are also considerable downfalls and risks to patient privacy and confidentiality. Strengths associated with EHR systems include increased access to care, improved quality of care, and decrease in healthcare costs. In our example, we discussed the benefits of Apple Health and its integrative abilities with Epic EHR system. Aubrey uses the example of an unconscious patient being brought to the emergency room and quick access to health data, emergency contacts, and medication lists. While this seemingly seems like an incredible advancement in technology, EHR systems also create conflict among several ethical principles. EHR systems must maintain respect for patient autonomy. Patient autonomy is jeopardized when patients' health data is shared without their consent. Ensuring that the person accessing health data is the patient or the provider directly involved in patient care is critical to protecting patient privacy and confidentiality. Justice is breached when a person of lower socioeconomic class or status does not have the equal access to health information resources. Total system failures and loss of pertinent patient data could also lead to patient harm. Although EHR systems can improve efficiency and healthcare delivery and improvement of quality patient care, the fact remains that there are also considerable risks to patient privacy and confidentiality. Thank you all for your time. This concludes our group presentation. The next slide includes all of our references.
Thank you.